Gormaiga Cahirlock, and thank you again to our speakers and particularly to all your members who have done us all such a great service. And while they've got plenty of plaudits in this House, I think that the phrase slap on the back isn't far from a kick in the arse probably was never more appropriate, because the litany of disregard and disrespect that has been outlined to this committee this morning, Cahirlock, to me is absolutely shameful. I wonder, is Ms Clark still there, and if she is, if she would be in a position just to outline where she stands this coming Monday. I think it would be useful for this committee to get a real-life experience of where our frontline workers, I don't mean to put you on the spot, but if you would be willing to do that.
Yeah, thank you. So originally I had finished maternity leave and I was due back to work when the coronavirus started. So I had just returned to work, had no childcare, and originally had to get my sister, who was on annual leave, to mind my child. And then I had to take 8 weeks leave and before I got approved to work from home. So at the moment I'm working from home, but due to the childcare reopening that I had pre-arranged, I am due back to work Monday the 29th. However, my child has never met the childminder, so he has to go through an initiation phase with the childminder. So I've had to take more annual leave for that first 10 days, so he can be introduced to the childminder, and she's phasing in the children. So I've to take 10 days annual leave, and then after that I can return to work full time.
Ms Nihay has, and indeed Mr Bell, have both made the point consistently in relation to annual leave. Chairman, you'll know that in previous committee hearings we've been talking about employers using this period in some cases to force employees to take annual leave during the periods they're not working. Essentially what we're hearing today is that our public service is doing the exact same thing. And we're now, and everywhere I go I see the flags saluting our healthcare workers. We hear the plaudits, we'll hear the ministers coming in here tomorrow, and all will say the same thing. What we also found out today is that while our healthcare workers are being applauded, their representatives are also being forced to take a case to the Workplace Relations Commission in relation to annual leave. By any definition, anybody who's forced to take annual leave to go home and mind their kids during a pandemic, that's not annual leave. And I wonder if Mr Bell or Ms Nihay could give us a sense of whether or not they believe that the department will renege and allow the very, I think, simple request that annual leave will be restored for that period, whether they have had any sense that the department is willing to accede on that point up until now.
Well, Chairman, or Deputy, I think to be fair, we have a fairly well-established industrial relations procedure in the Health Service, and if the employer had agreed to it, we wouldn't have needed to refer it to the Workplace Relations Commission as an outstanding matter that is disagreed. That's because the employer has not conceded the point. And interestingly, on a previous matter, on the circular that was introduced, Circular 33/2020, it is important to advise the committee just for on a point of information. That was introduced on the 29th of April, but it did not apply retrospectively. So in other words, from that point forward, you could have availed of it. But also, I think it's important that I read to you that as part of that circular, the HSE stipulates that managers should consider such requests in light of service requirements and the employee's particular circumstance. Service requirements will always trump employee rights in the health service because there aren't enough employees to begin with. So when managers are faced with that dilemma, what do you think they're going to do? They're going to force their workers to take annual leave. And that circular, in wording it in that way, allows that type of mentality apply. And what we're saying is that.
I just want to bring in.
Perhaps I could ask Mr. Bell a final question as well, because I think it's pretty clear where we stand in relation to that point. You mentioned that one of the private hospitals that's in receipt of public money has not been adhering to the public service agreements with regard to the workers. Would you care to name that private hospital?
You'll recall at the beginning of the committee we asked that people not be identified.
Okay. Deputy, to assist you, I think it's well known the hospitals, the big major private hospitals that received funding, and we ran into difficulty with one of those major employers, and I'm sure that through your own investigations you'll be able to find out what that is, because we objected on the basis that those hospitals became effectively Section 38 employments, just like St Vincent's Public Hospital or Beaumont or Tala. So we believe that the same rules should have applied, and we were resisted in one of those major private health systems.
Mr. Bell, and like Mr. Bell, I have every confidence in your ability, Deputy Carthy.
Thank you very much.
Deputy Foley.